Hi, I'm Rob Hoyle, joined today by Dr. Nina Vinkoff, a radiologist here at Reichert Family Imaging in Huntington, and we're talking about the importance of mammographies on this Breast Cancer Awareness Month. And if you have any questions, we're going to try to answer as many questions as we possibly can. So if you have questions, just type them into the comment section. Dr. Reichert, we know that mammographies save lives. Why is that?
I think the reason why mammography saves lives is really because early detection saves lives. Mammography's been around since the late 1980s. And before we had mammography, women were waiting until they could feel their breast cancers before they came to attention. And so the mammography mortality rate stayed the same for decades. Once we had mammography, we were finding cancers when they were smaller, lower stage, easier to treat, and the breast cancer mortality rate went down. When you look back now to the late 1980s, the breast cancer mortality rate has gone down by 40%. And that's really a tremendous success story, I think, for mammography and for early detection.
Right. And we're in front of a mammography machine
We
right
are.
here, and this is one of the newest ones. Is 3D, and it gives us much better pictures. Tell me a little bit about this machine and what it can do.
So this is our standard mammogram machine. This is the machine that we have in all of our offices here at Northwell Health. This is a 3D mammo unit, and what this machine does is it takes the standard mammogram pictures. It feels the same for you as you would have in your normal mammogram. 2 pictures from above, 1 of each breast, 2 pictures from the side, 1 of each breast. But what this machine also does is it swings around the patient, and it takes a series of images that we're actually able to look at on a special workstation. And on that workstation, we see slices of breast tissue that are as thin as a millimeter. And that really allows us to get a much better look at the breast tissue and helps our ability to be able to find cancer.
So you're really seeing inside the entire breast, and you can see things that normally you wouldn't have been able to see in the past, and that's the key to early detection.
That is the key. We are seeing things better than we were before. Studies have shown that 3D mammography increases the detection of breast cancer by about 40%. And the other thing I think is really important to know about 3D mammography is a lot of women worry about needing additional pictures after the mammogram, getting that phone call that says you have to come back and have additional pictures. By having a 3D mammogram, you reduce the risk that that's going to happen, also by about 40%.
That's great. And this is, over here we have an image up on the screen.
We
If
do.
you take a look over here, and this is what basically the image, if you want to just come around here.
Sure.
This is basically the image that you'll see, that the tech will see here.
That's correct.
But you'll have so many more images that you'll be able to see from your workstation?
That's correct. So when our technologists take your mammogram, they're standing here behind this leaded glass, and these are the pictures that they see. And those are the pictures really that tell them that they've taken the correct positioning, that there aren't any artifacts, and that they have all the information that they need. But those pictures get sent to the radiologist workstation, and there we have dozens of images to look at that you can't see on this screen.
And when you have an image, like this is one image here, you're able to zoom in, you're able to look at it from different angles.
Yeah, we are actually able to scroll through. That's a picture that's taken from the top. We're actually able to scroll through from the top of the breast to the bottom of the breast and see each 1 millimeter thick slice of breast tissue individually on its own. And then if we see something that's important in that area, we can actually zoom in and look at that area even closer.
Right, and I guess that's really, really important in the detection because you have such a much better view.
Mammography was a great test. Mammography was a great test before 3D, and this is just something that has made mammography even better.
Wow, that's awesome. We're gonna, if you could just walk us through what it's like for a woman who comes
Sure.
in and gets a mammography. I just want to say that if you're just joining us now and you have any questions, you could put them into the comments section. This is Dr. Nina Vinkoff, and we're at the Reichert Family Imaging at Huntington. And so, okay, so what happens? A woman comes into this office.
So basically when they come into this office, they're greeted by a technologist. The technologist will be the one who will direct the entire examination. We respect everyone's privacy. We'll have you change. You'll be in a robe. The technologist will bring you over to this machine and they'll position you. They'll use the right amount of compression for us to be able to see everything we need to see, and it should not be overly painful. Then for each exposure, you'll be asked to hold your breath for 5-6 seconds while we take the picture, and then you'll be able to let that breath out. And then they'll position you and look at each breast from the other view as well. So it'll be a total of 4 pictures.
And from what I understand with this machine here is that you're spending less time. It's taking quicker, and I guess it could be a little bit painful, but
Not painful. I would say uncomfortable.
Uncomfortable.
And I think what's great about our machines, our 3D machines, is we use a special software called CView software, and what that has allowed us to do is take these 3D mammograms in half the amount of time they were being taken before. So while it used to take 2 exposures in order for us to be able to get all the information that we need, we now have software that allows us to cut that time in half. So it's a quick bit of mild discomfort, I would say.
Okay, and the quicker time, though, I would assume means less radiation?
It's less radiation as well. So this software as well has decreased the amount of radiation for every 3D mammogram that we take by about 40%.
And I guess that's important for, very important for women who maybe are afraid of radiation.
I think, you know, the amount of radiation in a mammogram is very low. It's equivalent to really the radiation that's in the environment around us, but it's still radiation, and we want for our patients to be exposed to the least amount of radiation possible. So we're really happy with this technology. Basically what we have now is the best mammogram you can have. We have a mammogram that gives you the most information with the least radiation, with the least time to take the exam. If you want early detection, this is the mammogram that you want.
And so the recommendation is that a woman should have her first mammogram when she's 40?
Age 40. That's
Age
exactly.
40, and then every year after that. And why is that?
So multiple randomized control trials, and those are the best studies that we do in medicine, have shown that yearly mammography starting at age 40 saves the most lives. And so that's our recommendation. It's all about decreasing breast cancer mortality.
Okay, we're getting a question right now from Katrina. This is a question from Katrina. I'm turning 40 soon. Are there risk factors that mean I need an exam sooner?
So this is a conversation that I think all women should have with their doctor. There are some risk factors that might mean that you might want to have your mammogram sooner. You need to know your family history. You need to know the age of the people in your family and when they had breast cancer. You may need to have genetic testing, and that may be a conversation you may want to have with your doctor. You may have a predisposition that would actually indicate other testing is needed. So for some patients, in addition to mammography, we actually recommend MRI. If you have a greater than 20% lifetime risk of developing breast cancer, MRI is a great addition to your screening regimen.
Okay, great. And so I think what's also really important to point out about where we are here is that the people that are reading these mammographies are experts. They don't look at angles. They don't look at needs. Why is it important that the people that are looking at these images are experts?
I mean, I think for any imaging test you have, for any medical test you have, you want your doctor to be an expert. But I think for breast imaging, it's especially important because in this office, the doctor who's reading your mammogram can do any additional testing that needs to be done afterwards. So not only are they experts at reading mammograms, but they're also experts at reading breast ultrasound and at breast MRI and at doing biopsies. So we have the ability in our office here to do minimally invasive needle biopsies using mammography, ultrasound, MRI for guidance. All of our breast imaging expert radiologists are able to do that here.
That's great. In case you're just joining us now, I'm Rob Hoyle and this is Dr. Nina Vinkoff, and we're at Reichert Family Imaging at Huntington. And on this Breast Cancer Awareness Month, we're talking about the importance of mammograms and why they're so important. What are the conversations for, I'm wearing my pink tie today, and everybody seems to be wearing pink, but what are the important conversations we need to be having with our wives, our sisters, and our mothers?
So, I mean, I'm all for breast cancer awareness, and I'm so happy that it's Breast Cancer Awareness Month. But on the other hand, I think the sad truth about breast cancer is that it's a pretty well-known disease, and it's very common. It's going to affect 1 out of every 8 women in their lifetime. We're all aware of breast cancer. Breast cancer touches everyone's life. If it's not someone in your family, it's your friend, it's your coworker. And we know what some of the strategies are we can do to reduce the risk of developing breast cancer. We've gotten much better at treating it. But ultimately, the thing that I would advise everybody to do is to engage in early detection. Early detection is going to be the thing that's going to reduce your mortality the most, and it's going to be the thing that's going to allow you to find cancers when they can be easily treated.
Right. And I guess that's when we talk about if once you're hit 40, and then the recommendation is to have a mammography every year. I guess the good thing is that if something does show up on a slide, you know it's less than a year from the last one, or somewhere in between there. I mean,
absolutely. Lengthening the interval between mammograms just means that you're giving the cancers that might be there more time to grow. And what we want to do is find them when they're as small and easy to treat as possible.
Right. And again, early detection always being the key, because when you detect something early, it's easier to treat.
Of course. Absolutely. So one of the things that I actually wanted to show on the picture that's over here is, I mentioned breast MRI, great test for people who might be at increased risk for developing breast cancer. Another test that I think is really important to talk about that we do here in this office and in all of our imaging offices is breast ultrasound. And for certain people, breast ultrasound is a really important complement to mammography. If you look at the pictures that are over here, mammography is like a fingerprint.
Right.
It's every woman's mammogram is very specific to her. And it's a combination of the white and the gray that you see in that picture. So the white is the fibroglandular tissue. That's the normal breast tissue. And the gray is also normal breast tissue, but that's the fatty tissue. And every woman's breast is going to be some combination of those two. The reason why it's important to know how much of your breast tissue is white and how much is dark, that white, dense breast tissue makes it a little bit more difficult for us to read your mammogram. Cancers are also white. So if you have a lot of the dense breast tissue, mammography may miss some cancers. It may miss up to 30% of cancers in people who have very dense breast tissue. And so for those patients, we recommend ultrasound as an additional test. The other thing that's important is that although every pattern of breast tissue is normal, the people who have more dense tissue, more of the white, do have an increased risk of developing breast cancer.
Okay. And then do they still stay on that once a year?
They do. It's not so much that they need to come in more often, but it is enough that they should be thinking about having this additional testing with breast ultrasound.
So people come into this office, they come in when they're 40 for the most part, unless there's a family history or their doctors tell them they should start earlier. But you come in at 40 and then you get it every year. I would assume the majority of the people that they get a phone call and says, hey, everything's fine.
That's the most important message. I think people get really nervous about having their mammogram, but what they should know is that the majority of the time, you're going to get a phone call from one of our nurses saying, everything looks great, come back again in a year. About 1 out of every 10 people is going to get a phone call saying, we need to do a little bit more testing. That is not a reason to be alarmed. Even those people, most of them are going to turn out to be normal. But sometimes, if you have denser breast tissue, or if there's something that we just need to take a closer look at, you're going to come back. It might be for additional mammogram pictures, it might be for a breast ultrasound, and then you're going to get the result, and the doctor will speak to you at that time and tell you what the result is.
Okay. If you're just joining us right now, I'm Rob Boyle for Northwell Health, and we're celebrating Breast Cancer Awareness Month, and this is Dr. Nina Vinkoff. She's a radiologist here at Reichert Family Imaging at Huntington, and we're talking about the importance of mammography. So if you have any questions, by the way, you can type them into the comments section. We'll try to answer as many as we can. I think what's so amazing about a mammography really is it takes the mystery out of things, because it gives you that image, and I guess that's one of the most important things.
I think it's very empowering. It's a little thing that you can do that gives you a lot of information. It's a few minutes of your year, once a year, that can save your life.
And I think too, like that people should realize that, right? Because like it sounds like a lot, like every year, but you go to the dentist every year, or maybe twice a year, or a doctor, right? So this is just part of your maintenance of health.
Absolutely, it's critical. I think, access to screening exams has been the thing that's really made the most difference for breast cancer. Of all the things that we've done, like I said, we know what advice to give people to reduce their risk somewhat, and we know some new and always improving ways to treat breast cancer. But ultimately, we don't know how to prevent it, and we don't know how to cure every kind of cancer. But what we do know how to do is find it when it's early.
And that's, I guess, with this image, especially with the 3D imaging, it gives you such a much better look inside to see exactly what is inside.
Took a test that was great and made it even better.
Right.
And really, it hasn't changed the experience. Our patients can come in and have a 3D mammogram and not even realize that they have a 3D mammogram. The experience for them is the same. Right. From the point of view of the doctor reading their study, it's really like a completely different exam. We have so much more information. It's so much easier to read. And it's so much easier for us to find the little things that are there.
And just one more time, tell me how many, so this thing will swing around and kind of take...
This thing will swing around, it will stop 15 times, and it will take a small exposure each time. So as the patient having their mammogram, you'll hear it click across 15 times. Then it takes that information from its 15 different stops, and it gives us dozens, sometimes, depending on the thickness of the breast, dozens of pictures, each 1 millimeter thick.
That's awesome.
It's amazing.
We're going to take another question from one of our viewers. Alexandra wants to know, can you dispel some of the myths about false positives? How often does that happen?
Okay, so I think it's important to understand what we're talking about when we talk about false positives. So we know for screening mammography that about 1 in 10 patients are going to need to come back. While those are false positives, that's our expectation, that 1 in 10 patients is going to need more pictures. I think what people need to keep in mind is that ultimately, even if you're one of those 1 in 10, the chances that you're actually going to require biopsy, very, very small. Once we get to the point of recommending biopsy, at that point, about 75% of the biopsies that we do still are going to turn out to be benign. Of all the people that come in, 1,000 women come in, 5 of them are going to have breast cancer. Only of the original 1,000, only about 2% are going to be recommended for biopsy.
Okay, so we're talking about biopsy. Now all of a sudden biopsy sounds a little scary to me, but it's not that scary, a biopsy. It's kind of a relatively simple procedure.
It is a relatively simple procedure. We do them multiple different ways. So if we have a finding that we see on mammography, we can actually use mammography to guide us for that biopsy. So we're able to take pictures using mammography, clean off of the skin, give you some local anesthetic, so it's all numb. 5 minutes later, we're done with the biopsy. Same thing in ultrasound. If we see a finding that we're only able to see in breast ultrasound, using ultrasound for guidance, we can guide a needle in, have a biopsy done in about 5 minutes. Similarly in breast MRI.
That's awesome. So knowledge is power, and if you come every year, that you have that power, you have that knowledge, you know what's going on.
Absolutely.
What if you were to say, I'm pretty healthy, it doesn't really run in my family, I don't need it every year, and I'll get it every other year or maybe every 2 or 3 years. How much of a difference could that be if you were to have something inside with cancer?
So you talked about people evaluating their own risk, and I think it's really important for women to know that 75% of breast cancers are found in women who don't have a family history. So to evaluate your own risk and think that you're not at high risk because no one in your family has breast cancer may not be the correct assumption. I see another question.
Yeah, we have another question. But let's just finish this thought.
So I think for all women, across all risk groups, breast cancer is something that they need to be on the alert for. I think, for everyone, mammography starting at age 40 is going to be helpful. For some people, additional testing may be helpful. But for everyone, no matter what the risk group, mammography starting at age 40 is going to be helpful.
Great. So we're getting a question from Dennis. Do men benefit from
They do.
Okay.
And we do mammograms on men. Most of the time it's because they're feeling a lump in their breast. So today we're really talking about screening mammography. For men, for the most part, they come in because they need us to diagnose a problem that they're having. But there are some men who have genetic predisposition for breast cancer due to family risk, due to genetic testing that they've had. And some of those people will come in and have screening mammograms.
Okay. And so...
Just like women.
Right. Okay. Great. And that's something they should talk to their doctors about.
That is absolutely something that they should talk. Any man who's in a family where lots of people have been diagnosed with breast cancer should have a conversation with their doctor about whether they're at increased risk.
Okay. Great. And I guess the most important thing too, we're talking about the mammography once a year. It really is pretty simple. So we walk through the process of coming in here. The technician will kind of get you set and take the pictures. But as far as a regular doctor's appointment, it's probably no different than...
You're in our room here for about 5 minutes.
5 minutes.
Literally.
Right. From
the time that you come in till we're finished is about 5 minutes.
Wow.
Each exposure takes 6 or 7 seconds, and you're out the door in 5 minutes.
Right. So nothing against our dentist friends out there, but it's probably a little bit more enjoyable than being in the dentist's office.
Nothing against our dentist friends, but I think I would have to agree.
Okay. Simple things to do for our loved ones is to recommend, especially this breast cancer awareness, is to have those conversations.
Absolutely. And I think, if you think that there's any chance that you might be somebody who's at increased risk, that's a conversation to have with your doctor. I think it's a standard recommendation for everyone that they should have mammography starting at 40, but if you think that you might be in a special group, that's a conversation to have with your doctor, to see whether you should come in earlier, to see whether you would benefit from any of these other tests, to see whether you should have genetic testing. All that's important.
And conversations don't hurt.
Conversations are the most important things you can have. Absolutely.
Okay.
Keep
Great.
talking.
Excellent. If you're just joining us now, I'm Rob Boyle, joined with Dr. Nina Vinkoff, a radiologist here at Reichert Family Imaging at Huntington, and we're talking about the importance of mammographies on this Breast Cancer Awareness Month. And we get another question coming in from somebody from our audience. How often will a woman notice a lump herself as opposed diagnosed through a mammogram?
So and that actually depends a lot on the kind of cancer that we're talking about. For women that come in every year to have mammography, the number of what we call interval cancers, which is a cancer that came up from one mammogram to the next, very, very small. For people that are not coming in for regular mammograms, then obviously that number is going to be much higher. Before there was mammography, every cancer was found because women noticed a lump themselves. Now that we have regular mammography, that happens very infrequently.
Okay. And I guess, so what about a woman who kind of feels a lump in their breast and they're not 40, maybe they're 35? I guess, does it start with a conversation with the doctor, or do they just schedule the mammogram?
I think if you're feeling a lump in the breast, the first thing to do is to go to your doctor. I don't think that you should directly schedule a mammogram. I think you want your doctor to examine you, and then after that decide what the right testing is. We do mammograms on younger women when they have a lump. So when we talk about screening, we talk about starting at 40. But if you're having a lump in the breast, even having a mammogram at 30 might be the right thing for you to find out what's going on and why you're having that lump there.
So we know, starting in like 1980, when mammograms became more prevalent, people do that the rate of breast cancer deaths drops significantly.
That's right.
And technology keeps getting better.
It sure does.
Is it going to keep getting better?
I think it will. There's already some new things on the horizon. We talked today about mammography and about ultrasound and about MRI, but there's other new technologies that may become part of the standard of care. There's contrast enhanced mammography, where they actually put dye in before your mammogram. There's molecular breast imaging, which is a way to use as a nuclear type of an examination to look at the breast. And every day we hear about more potential ways to evaluate the breast. Okay, we're going to wrap up in a few minutes. If you have any more questions, you could always put them into the comments section. We're going to try to answer as many as we can. One last question for Dr. Vinkoff. What is
the takeaway, if one takeaway message from today's conversation on Breast Cancer Awareness Month, what is the main takeaway?
Listen, I would love October to be early detection month. And if there's one message I think from today, it's early detection saves lives, mammography saves lives, have mammography yearly starting at 40.
Great. Well, thank you so much. I'm Rob Hoyle for Northwell Health. We'll see you next time.
Thank you.